Luke Seesink, who is from our very own Safe Sight Institute. Now, this is one of the cornerstone programs of a Safe Sight Institute. It's not Safe Sight Institute is not just about the hard medical science. It's about helping the patients realise their full potential, and that's about helping them get in touch with the right agencies, helping them, get some advice from low vision clinics, from different NDIS providers. So, look, I think it's a great initiative. It's been running for a couple of years now, and Luke's going to be able to tell you all about what he's been up to and what the Safe Sight Institute is trying to do for this, and how it works with other agencies.
Hey everyone. So as Ray was saying, my name's Luke Seesink. I'm now the Patient Care Coordinator at Safe Sight Institute. I've been in the role since May this year. As a bit of background for myself, I'm an orthoptist. I've been an orthoptist since 2004, and I've actually worked with Safe Sight Clinic since 2015. Though orthoptics and ophthalmology is a very small profession, and I've had contact with Safe Sight Institute for many, many years before I actually started working with them. So I'm very familiar with Safe Sight and have been with them for a long time. So the Patient Care Coordinator, I put up here Eye Care Coordinator because I do some work at Children's Hospital at Westmead, and to call it Patient Care Coordinator, it's a bit broad for a hospital that does everything with children, not just eyes. So it's actually a free service for people with low vision in New South Wales and the ACT. So even though I'm based at Safe Sight Institute, I want to stress especially that I can help anybody who's living in New South Wales and ACT. Well, it's just at a push I could possibly help someone from somewhere else, but that's within my job title for New South Wales and ACT. They don't need to be a patient of Safe Sight Institute for me to be able to help them. So this position is actually funded by the Walter and Eliza Hall Trust, and I just want to tell you about them a little bit. So the Walter and Eliza Hall Trust was set up back in 1912. Walter and his wife Eliza were active philanthropists, and following Walter's death, Eliza set up a trust with a donation of £1 million. So it's a fair bit of money back in 1912. It's a lot of money here now. So since then, they've been working hard to help Australians in their time of crisis, and it's often a charity which is used when all other avenues have been exhausted. So they're especially interested in financial, giving help to those who are in financial disadvantage, especially those people with a physical disability. So the actual need for this particular position that I have came from days like today, where there was feedback, and so we actually made a proposal to Walter and Eliza Hall Trust to actually set up this position, and so here I am standing in front of you today. So what is the role? So my role is to be a liaison person between patients, families, carers, ophthalmologists, vision support agencies, healthcare professionals, education professionals, to help visually impaired people to navigate these support services. Quite often people who are first diagnosed, or families who have children who are first diagnosed with vision problems, come up against a wall like, so my child has this, or I've been diagnosed with this, this is my prognosis, what do I do now? What is there out there for me? How can I be helped? If you've never thought about it before, why would you know anything about it? So it's actually my job to help guide these people in finding perhaps the right services for them. What I stress to people also is that we're unaffiliated. So I'm not trying to push anyone into one service or another. It's all about talking to the patients and seeing what kind of thing might fit best, and in discussion with them. And then once I do refer people on, for example, to this service, I make a referral to them and I let them know. It's just like, let me know how you go with them. And if you're not happy, or if you don't think they're answering all your problems, or perhaps there's some gaps, I want you to come back to me, because I'm not going to be offended if you guys don't get along. I want to be sort of totally neutral, and I'm neutral. So I think it's nice that patients have this ability to have this knowledge, I should say, to be able to come back to me if they're not happy. If they're happy, well, that's great, and I'm trying to guide them to places, obviously, where they will be happy and things will be answered for them in the way they want. But I want them to know that I'm not, I'm not affiliated with any of the services that I refer people to. And just to say again, so like, because we're safe site, actually more than 50% of the patients who are referred to me never darken the door of Safe Site Institute either. So I get calls from people who, like ophthalmologists in rural areas, outer Sydney, so we're in the city obviously, outer Sydney, Canberra, who, I've never met, but I hear their story, I hear perhaps what they need, we have a discussion, and then I'm able to help them externally. There's a lot of things you can do online. If you know the right people, know the right contacts, you can do it, and you don't have to see people face to face. What I ask people who are referring patients to me is to give me as much information as they can, especially on the condition and maybe what their vision is, because like you'll fall into categories whether someone's legally blind or not, and that really can be quite a distinctive marker on how things are going to go for that patient and what might be available to them. So the role's also focused on being able to assist patients at significant time points on their journey, so including the initial diagnosis or significant change in their circumstances. So those kind of significant time points might be a child with low vision starting school, a child with low vision finishing school, a change in the visual disability. It's gone from being I can cope with this and that to I'm really not coping with this anymore. And then also I've found in the last few months a lot of people who we've just picked up who are kind of in limbo and a bit of a dead end, and you sit and ask them questions, and then you realise that they really haven't, they've had this condition for a long time, but they really don't know that there's all sorts of things that can be done for them, and it's a matter of saying, okay, well, we can do this and this, let's get the ball rolling on these things. And I've been surprised like how many people have just been in limbo, just sitting and plodding along, putting up with things that they don't need to put up with. Do you know what I mean? When there's services out there to help them. Because I'm an orthoptist as well, I can give plenty of information on people's actual conditions, what they've been diagnosed with, what's the reality of that. I can talk about some of the, the medical terminology and what that means for them. I've been an orthoptist for a long time, so I've had a lot of experience in explaining different visual problems and how the eyes work. And, if you have this problem, this is why it's a problem with this particular part of your visual system, and this is why you're having these symptoms. It's kind of nice to enlighten people on what's going on, because I think just people go from being quite afraid to, if you have something, you can wrap your head around, rather than like, oh, you have a rod cone dystrophy. Like, what does that mean to your average person? Nothing. I can sit down and actually explain exactly what it means and why that is. So being an orthoptist helps out. And often ophthalmologists don't have the time. They're able to, see their patients for as long as they need necessarily, but there might be another 15 patients in the waiting room, and I'm there and I've got time to actually sit down and explain it to their satisfaction, what's going on. Also can refer people to counsellors, for example, who have experience in low vision clients. Also, like I said, recommending external service providers and letting them know this, unaffiliated, so they can come back to me. I always encourage people to let me know how things go, whether it's good or bad, so then I can also speak to their referring ophthalmologist and keep the referring ophthalmologist in the loop about how things are going, and so then their ophthalmologist has a fuller picture of what's going on, because you can just say, oh well, your vision's gone from X to Y, but it doesn't mean anything. Like if we pull in, that's just like well, they're getting extra support from guide dogs, for example. That can be something that I can feed back in, and they don't always have to be responsible for, everyone's responsible for their own care to a point, but I'm here to just help facilitate and guide that as well. So we expect that the long-term outcomes for individuals and carers will significantly improve as a result of this position, and so what I'm asking people is for lots of referrals, and don't be afraid in coming forward to me. I want to be able to help as many people as I can, and then I'll still have a job. It'd be great. I want to tell you about a particular story. Hugh. So this is probably this is my favourite story so far. Hugh here is a 15-year-old boy. He lives in Sydney. I'd never met him before this picture was taken here. So I actually got a call from a paediatric endocrinologist one morning, and I thought, well, that's interesting. I've never spoken to a paediatric endocrinologist in my life. And she told me about Hugh, and Hugh has a particularly nasty condition which causes diabetes, and that's why he saw her. It also causes progressive vision and hearing loss. She was a bit at a loss on how to help Hugh because family situation not great, and some of the disability services that he required weren't liaising properly with each other, and it felt like he was one of these patients who's in limbo. So I also spoke to his ophthalmologist, and like I said, I hadn't met any of these people before, and he's a patient at Royal North Shore, so not even a patient at Sydney Eye. So I did some calls around and got down to the bottom of it, and I found that he had been assessed by Vision Australia and had been there'd been a recommendation that there were several apps and computer programs for him to use which would assist him. There was an app which will, because he's diabetic, like quite severe diabetes, and his vision's not good enough to monitor his own blood sugars. So his father couldn't work, and his mother had unfortunately passed away. So, like, really sad, and heart bleeds for this poor kid. Anyway, so there was this an audible monitor on an iPhone app, which would allow him to help self-monitor his diabetes. But then, because of different funding problems, and I wasn't going to say, but it was the NDIS, they wouldn't fund like an iPhone for him. So they'd fund the app, but not the iPhone, and also the laptop, and also a screen to push up, because he had a school laptop, but then it's got like firewalls, so you can't do lots and lots of things on his school one. So he needed like one where he could access the internet, and also a large screen just so he could see it because his vision's not good. So yeah, the funding for the programs and everything was available. The funding for the hardware was not available at all, and they couldn't afford it. So what I was able to do is actually apply through the Walter and Eliza Hall Trust for funding for Hugh. Let's put forward my little case, and very happily it was approved, and I was given a nice check to go shopping with. And so this is actually me presenting. Well, I went over to their place and gave him like this big pile of electronic stuff, including an iPhone. He wanted the jet black one. I was able to get that for him, which is cool. And his laptop and everything he needed. So it was just a little win, and for someone who, you know, really deserved it and had a lot of hard knocks. So that's the kind of thing I can do. So that's just one example. And look, other examples, I've been around to, a little old lady's house to help her fill in her form so she can get an Opal card, so she can travel for free on the train because she's legally blind. Just, little things like that. So, I probably wouldn't be able to do that if it was out in Dubbo or something, but I can get around Sydney, no problem. And when it comes to that, if it's something simple like that, I can definitely do it. But this was a particularly interesting case, and I worked quite hard on it. But it was really nice that I was able to help him out in the end. He deserved it. Very deserving young man. So I've got my contact details up here. Out on the Safe Site desk out here, I've got a bunch of cards if you don't want to write that down. And I'll be sitting at the table, so please come and have a chat to me as well. And probably, yes, I've done it rather fast, but I expected that. But I was just wondering if there's any questions at all from anyone. Yes. So, a lot of people who, if you think that your patient is perhaps needing something that guide dogs isn't able to, or it's not within your case studies, please, by all means, refer them on to me, because I refer lots of people to guide dogs, for example, and and I do tell them when you go to guide dogs, if there's anything guide dogs isn't giving you, yeah. So, whatever's outside your jurisdiction, and, you guys are limited, and, I'm not limited, so, I've been given this role, just help how you can and do whatever you can, so it's kind of nice, And by the way, I'm working the clinic as well, so we find patients who are in the clinic, and sometimes I just see someone's file, and then I just press them with some questions, and then they may actually need my help, and then... So what I was getting at is I'm always at the clinic at Safe Site, so I'm there 5 days a week. So even if I'm working in clinic, I'm still available to get back to you if that's the case. Yeah. Yes? Oh, sorry, no, I didn't say that. It's a totally free service. And so all my running around, it's all totally free of charge. And that should have been my first point. Sorry. No? All right. Thanks very much, guys.